It's very interesting to me that the U.S. government essentially is not doing much of anything to help prevent any type of virus entering the U.S., mainly Ebola. We just had the Saudi Arabia Kingdom announce that they have canceled all visas from the Congo and all the affected areas. We I spoke about the flights that were being canceled out of, where was it, the UK, South Korean Airways out of Fiji because they know something was up. But what people aren't really seeing, and what many people don't even know about, because I'm going to be honest, I didn't even know what this event was. It's called the Haji, maybe that's how you say it. It is the most special pilgrimage. It's a pilgrimage for Muslims, and hundreds of thousands of them go to Mecca in Saudi Arabia each year. This year it is in about a week, August 9th or 19th. It's coming up, and this would be essentially a petri dish of disease spreading. It would be just like I don't even know how to explain it. If Ebola did get into this event, everybody around the world would be screwed. I'm going to show y'all some footage of those events and how many people are there and how close they are. This isn't just like, oh, being at Walmart and people walking by you, or Disney World, people, they are like next to each other everywhere. But the Saudi Arabia government has actually stated that that is why they canceled visas out of the Congo. But how come there's no travel bans or anything going on? We've actually allowed thousands, or at least hundreds, within the last few months of asylum seekers to enter the country. Why is that? From the Congo. And now we know for a fact that it has gone all the way to Kenya and Nigeria and Sudan, but yet our government doesn't seem that concerned about it. Honestly, I don't know what else to do. I've been trying to sound the alarm that this is going on for a couple of months now. We have countries canceling visas and flights to these affected areas because if they get on planes, it could go anywhere. And they know that, and it probably has. I would pretty much guarantee that it has, and they have just continued to keep it under wraps. Now we have, it definitely has hit one of the most populous towns called Beni in the Congo. There's like 1 million people that live there. Some people say 2 million. It's kind of, I don't know why there's differing numbers. That doesn't even matter. But the thing is, there are people dying at home because they don't even want to go seek treatment. So this 1,700 deaths that they keep saying is the actual number of deaths is absolutely false. There's no way that it's factual. And they're even admitting that there are people just dying at home. They'd rather just die at home and not even go seek treatment. That was an article that was put out today, and I'm going to show y'all that in just a minute. I just don't understand how people are just being so flippant about, oh, there's nothing really going on. It's very strange when the mainstream media is not talking about something that could induce fear, because they love to do that. They absolutely love to do it. But when something's actually going on, they don't do it. And that's what concerns me the most. I just don't understand how people are ignoring all of it. And the people that go to Saudi Arabia for this Haji come from all around the world. From the US, from Pakistan, from Africa, from all of these countries to meet in Mecca at this thing called the Cube. And it's a pilgrimage. And they're all in very close quarters. And then they're going to get on planes and come back home. And if you've been paying attention to my videos, you should understand that Ebola has been known to lay dormant for years. I don't know what else to actually say about this. I mean, I'll continue giving you up-to-date information as it comes out. But the only thing we honestly can do is protect ourselves and try to prevent this. That is the only thing we can do, because the U.S. government sure isn't doing it. I have done multiple videos about how to help prevent and protect yourself and your family from possibly getting this. And also, I began taking, it's called Silver Solution. The link will be below. I've gone through all of the information. I can't tell you that it actually does anything, but having that in your body, this is not colloidal silver. People are very confused about the difference. It's not colloidal silver, it is an alkaline. It's not acidic like colloidal silver. And so when a virus enters your body, it wants to find the most electric, I don't want to go into too many details on what it does because it's kind of confusing without going scientifically about it. But it attaches to those molecules and it excretes out of your body rather than it connecting and entering your cells. Okay? And I've explained it in other videos. I don't want to drag on about it. But you can get the kit, or you can just get this. There will be a 20%, the link has a 20% off coupon, and you just take 2 teaspoons of this a day, and me and my kids are taking this, and they have the soap, the gel, and different types of things, lozenges, and all of that. So let's get on with the articles and check out what the new information is going on. Alright, let's get to it. Alright, so let's start with the articles first. Oh, this one's just to remind you of be vigilant. Oh, this I did not even mention. Dengue epidemic in Honduras is collapsing the hospital network. This is insane. So far this year, more than 28,000 Hondurans of dengue. Oh, crap. Stupid ads. Are you kidding me? Of dengue epidemic, which 54 people have already died this year, has collapsed the hospital network of this Central America country. That is insane. Y'all, Honduras has gotten so bad ever since we put that puppet in as the president. It's really sad, honestly. Right here, too many Congolese, too many Congans Ebola outbreak are dying at home. 2-month-old, blah, 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 became an orphan in a day. Her mother succumbed to Ebola. See, people are dying at home. And it's not being reported. Because like her case is, but these people are going to die, and they're going to attribute it to typhus or measles or, anything else, malaria, because they all have the same symptoms. If you don't test for Ebola, then you won't know that they have Ebola, because a lot of times people with Ebola also have malaria or typhoid or something else in their system, which already degraded their immune system. And so that's good for the government and everybody, because then they don't have to admit that there are more people dying of this than actually are. You see what I'm saying? But you can read that article. Then we have the Saudi Arabia suspends visas to people from the Congo over Ebola. Saudi Arabia has stopped issuing visas to people from the Congo while citing the Ebola outbreak there, when even as the World Health Organization recommends against travel restrictions. Why? Why? Well, I explain that. The World Health Organization was forced to recommend against travel restrictions because, oh my gosh, because of trade and because of travel revenue. That was the only way that these governments would allow the World Health Organization to call it a global crisis. Do y'all understand what I'm saying? See, the World Health Organization is essentially, they want to say that there should be travel restrictions, but they had to ask for this global health emergency 4 times before getting approved. And they even said it in their paperwork. I've done that. I'll put the videos at the end of this video. You can click on those if you haven't seen them. And it was because of travel, tourist money and trade, because they didn't want to mess up trade and things like that. That is ridiculous. So that just shows that none of our governments really care about us. They care about their trade and all of these other things. And then they are running low on these vaccines that honestly aren't even working. The World Health Organization, preparing for the worst, makes plans to reduced doses of Ebola vaccine. So they're going to be like cutting the vaccines in half because it takes like a year to make these vaccines or something. The World Health Organization is drawing up plans to use reduced doses of the Ebola vaccine in the Democratic Republic of the Congo in the event that supplies in the long-running outbreak run short. See, a lot of people don't realize that this has been going on for almost a year. Most people didn't even know about it until the World Health Organization deemed it a public emergency, except for obviously people that have been paying attention to my videos and other people's videos, not just me. But so it has eased pressure somewhat on the management of supplies. It's just really silly, and they're essentially saying it's not working. So look at how many people are at these things. So I said a couple 100,000, no, 2 million people do this every year, coming from around the world. 2 million. Wow. Could you imagine if just a few people had Ebola at this event? Holy crap. Alright, thanks guys for watching. I hope that helps. Sorry, I've been kind of redecorating. I don't know what I want in my background, so everything's kind of messed up. But y'all have a wonderful day. And if you would like to help support my channel, the links will be in the pinned comments along with the link for the silver. And every donation is very helpful because it is very hard to get videos monetized these days. And then when they do monetize them, it's usually after all of your initial views, which really sucks. So they may look monetized, if you go watch it days later, but you essentially lost all that revenue from like the first day that it's put up. That's when you get most of your views, and that's when they're demonetizing our videos. It's happening to the majority of us, and it's really hard. It's really hard to continue doing the amount of research that I do anyway. There's some people that just don't do any research and they just talk, which is fine. That's their thing. But y'all have a wonderful day. Like, share, and subscribe. Bye, guys.